welcome back to Quality Coffee Break as we break down quality principles as they relate to medical devices. How you doing, Susie?
Amy, how are you?
I'm very well, thanks. I'm all good. What are we talking about today?
I think we are going to talk about investigations.
Very good, very good. Yeah, investigations I think is something which is just so core to any quality manager, any quality professional. You're always going to come, up against investigations, and we've spoke previously about we think it's really important in terms of how they're handled because a lot of times people can maybe get a bit defensive around about investigations, can't they?
Definitely.
I think we're going to be talking a little bit about that. So what kind of investigation do you think that we should be starting with? What would be like a nice common one?
Um, a nice common one that I think spans different industries would be something like a piece of equipment outside of its calibration or that failed its calibration or something where it's not quite calibrated correctly.
Yeah, that's such an easy one, isn't it? And then very critical for manufacturers. Okay, so let's picture the scene. You're at your desk doing what you're doing normally, and then you have maybe somebody from QC or somebody from the manufacturing floor who's coming up to you. Maybe a little bit panicked. Maybe a little
Yeah.
bit panicked.
Yeah, maybe a
Um,
little bit.
yeah.
Maybe a little bit sheepish.
Maybe as well. And then they've got a piece of critical equipment which is out of calibration, so it could be something like measuring or maybe something on the production floor. So yeah, what would we start with? How would we handle that situation? What do you reckon, Susie?
Well, first I want to know what it's used for.
Mm-hmm.
And is it like a refrigerator? Is it a storage, like controlled temperature storage or an incubator, those kinds of things? What I want to know is, or what I'm looking for is the impact on the product quality and the impact on the quality system. So critical to understanding that is what are we using this for?
Yeah, absolutely. So I have a bit of a catchphrase at work.
Okay.
It's called "What's the risk?" And that's exactly what you're describing there, isn't it? It's just like, well, knowing exactly what that piece of equipment is going to be used for, how it affects, both the product but also the QMS as well, is really, really critical for understanding. So, yeah, I think you would use all of those things to determine the risk, and with your CAPA system or your investigation system, you may have one that will actually sort of use those starting questions to determine what actions that you take next. So would it just be correction? Would it be corrective action? Do you need to look into non-conformity of the product? All things to be explored. But those first few questions are really critical, aren't they, to sort of understanding how you're going to be doing your investigation.
Absolutely. And I think with any investigation, whether it's a calibration issue or an a labeling issue or whatever else it might be, there are some core elements that I think transcend. And to me, I look at these things as safety first, whether it's like the safety to the patient, the safety to the user, um, and that means an employee of your own organization or a potential user of your end product, your finished product. I'm going to be very concerned about identity and whether the labeling is correct. Does the product contain the information that it's supposed to contain to say what it is, what its strength is, if it's something that requires like a concentration or a quantity, an expiration period, like there's the required elements on a label. That's going to be the second thing I'm asking about. Um, then I want to make sure that the product isn't adulterated or contaminated in any way. So I want to make sure that there isn't any foreign material, or if there is, if somebody comes in and says, "Hey, this particular reagent has particulates in it that I'm not expecting to see," then
Mm,
what? Then you're investigating what is that? Does that have an impact on safety for
yeah.
the patient, things like that. And then finally, um, how does this relate to our performance specifications? If you're talking about a finished product, does it still is it still compliant with your labeled specifications, meeting your requirements? If it's a component or an internal product or an internal something else, then you're looking at, what does your procedure say? What does the manufacturer's instructions say? Those kinds of things to help identify or pigeonhole where your risks are for the particular issue. Back to your point of what's the risk.
Mm-hmm.
That's how I think about and identify the risks.
I think that's absolutely excellent. I mean, so like applying that. So I think a really good way, because you mentioned about product specifications. Now, if let's pretend the operator that came out with somebody from QC who's measuring certain aspects, could be like some calipers, or it could be, you know, some other measurement device. I mean, with it, we know that there's quite a few. So if for example, they found that this piece of equipment was used outside of its calibration, I mean, one of the first things I would say we should do is like, okay, well, what is the outbound calibration? You know, what is it actually reading at? Because using that as your first step, that's one of the things that you can do to identify, you know, what is the risk. Because if you calibrate it and it's actually still within its specification, there's not an issue really, is there?
No issue. Well,
No issue.
you have a QMS issue
Have a
because you
Q. Yeah.
didn't, maybe it wasn't calibrated on its schedule as expected. But if it's not out of tolerance,
Mm.
no
Then
impact.
yeah. We're minimizing the risk in terms of, you know, your QMS, and then we've said like there's no impact on the product. That's great. But yeah, if it was out of range by potentially quite a lot, then obviously we've got to think about the impact of the product in process and whether actually it's been released as well. Because as we know that there's different requirements for products that you've detected as non-conforming before its delivery and then after. So it's kind of like, what do you do in those situations? If it's before, you know, containment, we want to contain it. Is there ability that we could potentially release it? Can we do any other tests which would mean that it would be accepted under concession? If not, obviously restricting its use. And then if it has been delivered.
Well, then I think you kind of do a pretty big risk assessment and you're like, okay, so this is in the hands of our users. And you can do things like health hazard evaluations and say, okay, well, if this um, widget was 2 millimeters larger than it should have been, or smaller than it should have been, or something like that, what does that mean? Does the product still perform correctly? And if it's an internal part of the process and you have done a finished product QC at the end of it, you might be able to say, look, it may have been, this internal component may have been outside its spec or outside of its calibration, or the calibrate, it was outside the calibration, didn't detect something that was outside its specification. But the truth is that all of those products go through a finished, final finished product quality control, and where its functionality and its performance was tested against our specifications and release criteria. Therefore, there's no impact to the end user.
Yeah, that's a really good point. A very,
Right?
very good
So
point. Yeah.
where in the process this product or measuring device or element is used can have a big impact on the final decision.
Absolutely. Absolutely. And in terms of like managing the investigation, in the intro, we kind of spoke about a little bit about, you know, handling personnel. I mean, I've certainly come across in my career where people can be quite defensive and potentially unwilling to help with the investigation. Something which I always say to my colleagues is that if we are investigating something, we're not investigating you, we're investigating the process.
Oh, always. Yes.
Right? Because that's the first thing. It's like, well, you know, how has the process failed this person? Right? You know, what can we do to improve the process? So, you know, if you know it's a calibration schedule, it's just like, well, are there notifications for it? How is it managed? Is it visible, or are we just depending on people remembering? And you know, depending on people remembering is is never going to be a good idea, right? So what about the process can we improve? And if you get those, you know, operators involved in that, then I think they're going to be so much more happier because this might have been something which they've wanted to raise for a while, right? So you're also empowering people who are working within these departments to actually facilitate change. And it's all about, in our first episode we spoke about the relationships, right, that we have with everybody. And it's another example of how you can really form these good relationships in quality in other departments by working together to resolve the issue.
Yeah, I think that's great. And you really bring up how that initial, and maybe you meant this or maybe you didn't mean it, but this is just sort of the way your quality brain works. Um, there's the initial, hey, we have a problem. And then you've gone right into sort of, okay, basically the steps of a kappa investigation and
Mm-hmm.
documentation of a kappa, right? So that's a big clue. That's
Mm-hmm.
the record that you should be creating when somebody does bring something like this to your attention. So you can do a good root cause analysis. And as Amy pointed out, evaluate the process. Make sure that you're putting controls in place that are not dependent on a person and that will serve your organization well, regardless of who's in the specific roles.
Absolutely, absolutely. I couldn't agree more. But yeah, there's something else that you might be able to find useful when you do your kappa processes. Now, I am the first person to admit the first time I implemented investigations and like non-conformances and kappas, everything was pretty much handled the same way. And didn't really take into consideration, what the impact is, what the risk is. I mean, this had quite a large consequence because people were investigating quite small issues, right? So, we didn't apply the risk-based approach of which I am so obviously so much of a believer now that you need to have into your processes. But there is a really helpful, I think it's an IMDRF document, which I think everybody should read. I will pop a little link to it below the video, because it really talks about this concept of non-conformity grading. Now, when you get into non-conformity grading, you've got your indirect processes and your direct processes. Now, how the IMDRF document describes this is anything from section 4 to section 6.3. So you talk about your document control and all the way to infrastructure. All of that is they're supporting functions, right? So they're supporting your QMS in terms of its just general use. But then also you get into work environment and then all the way through to section 8. Those are your direct processes. So if anything goes wrong with those, they can have a direct impact in terms of your product. So when you apply this approach to doing investigations, you might find it helpful because you could say, for example, if you have a first-time occurrence for something like document control, maybe the only action you need to take is a correction. So you're just fixing the non-conformity. And potentially then, if you're looking at the direct processes, because it has a direct impact on the process, you may be doing a correction, but you're also looking at the impact in terms of the product as well. And then you can also have a think about whether it's the first instance or we've got repeat occurrences of the same things happening. Because if we've got repeat occurrences, then it could, indicate systemic failure within that area. So you may want to be throwing more things at it, like doing a proper sort of root cause investigation and then associated corrective actions as well. So it's just like something to consider when you're, if you're looking at your investigation, the way you're handling your kappa system, because if you're reducing the amount of work that some people have to do, and that's really nice, isn't it, when you can actually reduce the work that some people have to do, people actually might be more forthcoming in terms of sharing things that they don't particularly like and being proactive in terms of making their quality system better and raising issues such as things that we've just been discussing.
And one of the great things I think about 13485 and the FDA regulations and all the other standards in the world is that they allow you to create whatever system, whatever process you want to be compliant with the standard. So it will say, apply a risk-based approach to this, that, and the other thing. And so you can define in your non-conforming procedure, your or non-conformity procedure, or your CAPA procedures, or whatever they might be. Say, this is how we're going to prioritize or risk out our events, and these are the expectations for investigation or remediation associated with them,
Mm-hmm.
commensurate to that risk.
Yeah.
And that's also going to depend on the product that you're performing or you're producing, or the service that you're providing, and those inherent risks. I mean, when you're talking about an implantable medical device, you're talking about a shoulder replacement or something like that that is going into a human body. You may, um, you should evaluate things from a different approach as to the diagnostic tool that I'm creating, which is a series of reagents that detect infectious disease that is highly treatable, right? So there are different risks associated with those products. And so you have that freedom to create and apply a program that's appropriate for the risks associated with your product and the risks associated with your activities. Write it down, follow the guides that you set for yourselves, and defend it. So I've typically done things that, like when we're talking about risking or setting priorities for CAPAs, a simple grid that's based on severity and detectability of an issue. So, and again, defining what those levels are is dependent on the risks associated with your product and service. And, you can have something that's a catastrophic issue that might be a public health risk. But you might also have a product where you're like, okay, well, the worst thing that's going to happen is that there's a delayed result or a delayed treatment or something like that. This is very different.
It's such a good point. It's why risk management is so important, and why keeping on top of your risk management throughout the product life cycle is really going to help you, especially when it comes to investigations, right? Because if you are seeing things like kind of going to a little bit of post-market surveillance, and where you might be receiving some feedback from potentially a non-conforming product on the market, right? So all of that information is going to go into your post-market surveillance, going to update, and you can really keep an eye on to see whether we've got catastrophic issues actually happening that we didn't foresee in the first place.
The other thing that I wanted to bring up that you made me think of when you were talking earlier about setting up appropriate risks for correction only or indirect or direct clauses and things like that,
Mm-hmm.
is that you talked about if it's a first occurrence, then maybe you can just be fine with a correction, or if it's happens multiple times, that you would do something different. Well, you can also rely on your trending activities, right? So section 8, or clause 8, you're going to have to do some tracking and trending, and you can do that during post-market surveillance, but you also will probably get to a point where that's not frequent enough, and you're going to do trending on a monthly basis or on a quarterly basis, or whatever makes sense for your organization at the time that you're working on it. Um, and so let's just say you don't have an easy mechanism for tracking whether this is a first occurrence or a second occurrence or a third occurrence or what have you. You might be able to say, look, we're going to do them all as corrections, and we're not going to do any deep root cause analysis until or unless it is identified as a trend during our regular trending activities. And then we'll see, oh, look, this has happened 5 times in the quarter. We're going to escalate this to a that next level of a kappa.
I think that's a really good way of putting the example I gave into practice. I think that would be a really good thing for people to be doing is utilizing the monitoring of the product, monitoring and process, to identify where we've got those sort of negative trends emerging, because you never know, like you might be able to get in there a little bit before, so instead of a corrective action, it's a preventative action, which is obviously what we all want, don't we? Prevent rather than correct, but yeah, keeping an eye on our processes, so key,
Yeah.
so key.
Yeah. It's great. I mean, you have so many tools.
Mm-hmm.
There's so many tools available. You just need to maybe think outside the box. And I would just encourage you to always consider the the stage of your organization and the product that you're creating or manufacturing or the service that you're providing and those inherent risks. And feel free to be creative to create a system that makes sense to you.
Absolutely, and create a system which encourages people to come forward with
Oh,
issues.
yes.
Yeah.
Yeah.
No.
I mean, that should go without saying that this cannot be a blame game.
Yeah.
And things don't become, or issues shouldn't become personal performance issues until you have exhausted a
Mm-hmm.
hundred other things.
Oh yeah, absolutely. I mean, there's the age old, the really bad example of, I don't know whether this was an old wives' tale or it actually happened within an organization. Now I'm going to say it, and you can tell me whether you've heard of it as well. There was a company that linked performance, like performance valuation that everybody has, once a year, to the number of non-conformities. And then surprisingly, they saw a sudden drop in the number of non-conformities that were raised. Now, I mean, maybe it worked really well, but the pessimist in me just says that this was just building a system when nobody actually wanted to come forward with non-conformities or investigations. I don't know if you've heard of that or whether it is an old
I
wives'
mean,
tale. I don't know.
I don't think I've heard of it as like there's a specific case, like, hey, there was a company that did this and it was bad. But I think that there are probably lots of
Hmm.
um, leaders who maybe flirt with that idea
Yeah,
until they're hopefully set straight onto a different path and
yeah.
identify why that might not go as planned.
Yeah, absolutely. Bad idea. Don't even think about it.
I mean, I look at it, especially with like an early stage company.
Hmm.
Um, that kappas are only good things because we have so much opportunity to improve our processes, and kappas help us identify those processes that need to be improved and either made more effective and easy to do for the employee who's doing it,
Hmm.
or just to work through the organization in a slightly different way, or workflow, all kinds of things. But you don't know what you don't know. Kappas are the way that you start to gain that information, gain that knowledge, and can help target your opportunities for improvement or your continuous improvement efforts and things like that. So I don't, I don't care how many. I absolutely do not care how many kappas we have as an organization when we're in this phase. When you're in this early phase, don't care. These are only good things.
Yeah.
And, when you get to a more mature organization, I think, yeah, then you might have goals or objectives where organization wide you want to see a decrease in your kappas,
Hmm.
but, again, not to a person, and definitely
Yeah.
need to strike that balance of ensuring that people are forthcoming and they're reporting the activities and the events that happen as they should, and also the organization.
Yeah, absolutely. I mean, I've had experiences where when you have like lots of new starters, for example, kappas just go up. Now, I think that they go up because they're really testing your processes, right? So if you've come from a small organization and then somebody's written, they've written like the SOP and they think, oh, it's wonderful, then blah, blah, blah. But it's only them and maybe one other person that needs to follow it. And then you get 10 other people that join the organization, have to follow the same procedures. That's the moment that you find all the gaps. But it goes into the importance of when you get new starters and everything, people are just going to interpret and read things differently.
I mean, I have worked in an organization where the kappas, in large part, were done and dusted by the manager of the department, and not they were not involved with the actual, commission of the crime, or the or the you know the error itself, but they've written down the root cause, they've created the corrective action all by themselves, sitting behind their keyboard, and they roll out, and of course, it doesn't work because they didn't actually understand the root cause, because they didn't actually talk to the person who was involved in the error.
Gosh. Oh
So
gosh.
that was I mean, and that was commonplace 20 years ago. Right, and then you grow and you learn and you say, "Oh, that didn't quite work out the way we expected. We're not seeing a reduction in errors. We're not seeing our processes improve because we haven't really done the right kind of investigation on it." And it doesn't have to be long. When you say investigation, this isn't a weeks long activity. This can
Hmm.
be a half an hour conversation between like two or three people.
Yeah.
Done. Like, doesn't have to be this massive thing.
Yeah. And all you need to do, right, is like act like a 3-year-old, right? Because
Tell me more.
you just gotta ask why all the time. So this happened. Why did this happen? Because this happened. Okay, well, why did that happen? 5 whys. I love that one. I think that's probably my favorite. If I was to
Mhm.
choose one,
Mhm.
probably my favorite root cause analysis methodology.
I think it's a great tool,
Yeah.
especially for relatively simple and straightforward
Oh yeah.
issues, which is what 90% of what
Hmm.
your issues are. I think
Yeah.
Five Wise does a great job. What are some of the other tools that you like to use if you're investigating maybe more complex issues?
Fishbone diagram is a pretty is a, oh,
Can't go
oh.
wrong.
It's called something else properly, but I don't think I can pronounce it, so I'm not going to try. But everybody should know by this fishbone, and then you have all your different areas. You might have environmental controls, training, processes.
Man, machine, environment.
Love it.
I can't remember all I think there's 6 standard ones that you should be evaluating. What I like about that one too is that um, it asks the users, or the people in the group, to brainstorm possible ways that things can go wrong. Not necessarily what do you think happened in this case, but if you're talking about a calibration um, error, right? The ways that it can go wrong is that, it can be that somebody forgot. It can be that the tool wasn't used. It can be that there is no tool. It can be that the uh, calendar didn't account for public holidays, or like it can be a whole bunch of different things. And so I like the fishbone that allows you to sort of say, okay, these are the most likely in this case. You might not ever be able to identify exactly what went wrong in this particular case. But by doing that, you can say these are the most likely contributors to this error, and let's attack.
Hmm. Yeah, yeah. It's a very useful tool. I completely agree with you. Completely agree with you. Right. Anything more for investigations? I think we've pretty much covered this, the core values, right, for a successful investigation.
I think we have. The only thing maybe we didn't talk about, and this is a little bit more just CAPA related, or and not so much investigation, but that verification of effectiveness,
Of
sort of at the
course.
end of the process,
Yes.
right? So you've
Yes.
discovered the error, you've investigated it, you've created a corrective action, you've implemented that. How do you verify that that is effective? And when do you need an effectiveness check? Because I think, to your point earlier, like at the beginning of our discussion, there are simple things that maybe just need a correction, and maybe don't. These aren't things that need an effectiveness check follow up in 2 months' time. Um, but I think that there are plenty of cases, certainly the higher risk issues, where you would want to do an effectiveness check or
Hmm.
two,
Yeah.
right? Where you're looking, um, did this did this corrective action and preventive action, this corrective action plan, so to speak, that I've put into place, did that actually address the issue? And if it's something that you can measure by doing a record review, great. Make sure that you are saying, "Oh, look, if you found the error and it was one of these things that happened 3 times in a month, then you want to make sure that your review period is long enough to capture if the error had recurred at a same or similar rate." So you'd want to make sure maybe you're looking at 2 months worth of records and counting up the errors.
Yeah, and I think as well, I don't know if you have, Susie, but I've definitely seen people mistake verifying implementation of the corrective
Oh,
actions
yes.
and verifying the effectiveness of the corrective actions, because they are two different things. I mean, because I mean, often your corrective actions are going to be an update of a procedure, performing training, those very sort of common things. So making sure that when you're saying like, oh no, this has been verified effective, you know, because the SOP has been issued and because training has been performed, is definitely different from actually going back and checking those records to make sure whether, for example, if we go back to our example of the piece of equipment that was calibrated. So if it's like a monthly calibration or a weekly calibration, as you say, Susie, building that into your verification of effectiveness check, and then making sure you've left enough time and checking those records that they have been, that piece of equipment has been calibrated that many times. And sometimes not being afraid to leave quite a long time for your verification of effectiveness.
Absolutely.
Because what happens if it's a supplier? We all work with suppliers. Sometimes they can be great, sometimes not so great. So when you're working with a supplier, for example, they've given you, non-conforming product. Now, to verify the effectiveness of maybe their improved controls, but you don't order from them very often, maybe once a year, you could have a capper open for many months and potentially, even a year. So I think it's not being afraid to leave the verification of effectiveness check for as long as you need it to be. Because you're going to have your rationale in that capper anyway. So just sticking to your guns and knowing it's the right course of action.
Agreed. And I've even done it with the particularly high risk issues to have a second effectiveness check. So I might do an effectiveness check like within the first, 2 months or something like that after the corrective action plan has been fully implemented. And then I might let it sit for another 6 and just say, are we still compliant? Do we have sustained effectiveness of this corrective action plan?
Mm. Yeah.
And that, again, everything's dependent on the risk, right? Do things that are
Mm-hmm.
commensurate with the risk of the issue that you're working with.
Mm-hmm.
Um, but nothing wrong with it. You can have those things open for 6 months where it's just waiting, and that's okay. So that was the last piece that I wanted to bring up about investigations and the kappas and how we resolve those.
And yeah, we've covered all the good things, haven't we? Making sure that we're defining what the risk is. What is the risk, and using things like what that piece of equipment or what that area is. You may want to be thinking about direct or indirect processes, and whether it's the first occurrence or it's the second occurrence. What is the impact on the product? Has it already left the building? Is it in house? And also being sensitive to those emotions with people as well. So gaining their trust and allowing them to have their side of the story, and you're focusing on the process. You're not focusing on the person. So making sure that is understood within the organisation. And then if you need to, you're leaving enough time for the verification of effectiveness. Don't be afraid to have a long verification of effectiveness if it's needed. So
Yeah,
yeah, great
I think that
discussion.
sums it up.
Yeah, great discussion, Susie.
Great
Love it.
discussion. So I don't know if anybody has other things that they want us to discuss, maybe, or go into more detail on this, because I think each one of these can be a full conversation itself.
Mhm. Mhm.
So again, leave us a comment, send us an email if there's something that you've got more questions on or you think would be a good topic of discussion for us. We're happy to consider those.
Yeah, absolutely. Yeah, don't be afraid to get in touch. And yeah, we will see you next time. So yeah,
Great. Thanks,
thanks, guys.
everyone. Bye.
Bye.